Hello, I'm Jorge Garrido. I'm director of Apoyo Positivo, one of the biggest organizations in Spain responding to the HIV/AIDS pandemic and also sexual health in the country. Spain continues being one of the countries in Europe with the highest new HIV infection number each year. We diagnose in our country around 4,000 new HIV diagnoses, which is something over the average of Europe. And especially we have some of the cities with a high number of new HIV infections like Madrid and Barcelona. The most part of the cases are related with the community of men who have sex with men, gay men and bisexual men. And one of the problems that we have in the testing and diagnosis of HIV is that over the 40% of the new cases are presented with late diagnosis, which is something that probably is still keeping this pandemic of the new HIV infections in the country. In fact, if we look at the numbers of the Fast Track Initiative and the Paris Declaration, Spain missed 13–15% of the people living with HIV knowing their status. And it's also on another topic and another place of work for our organization, and also the response of the HIV in the whole country. And regarding the topic of this year of the European Testing Week and our daily work, also in the epidemiology, we see that there is a high number of people that is not from Spain. They didn't born in the country, or they come from another countries to live in our settings. It used to be normally over the 30% of the new HIV diagnosis per year. So the group of migrants or refugees or people from other countries that we manage with HIV infections in the country is high. Apoyo Positivo is a community resource created in 1993 during the beginning of the HIV and AIDS pandemic in the country. And it's focused to attend and promote diversity in health, education, and rights. We are specialized in sexual health and sexuality education and promoting the sexual and reproductive rights among the most vulnerable communities. And those are the communities that we are more focused on, those ones that, because of their diversity, need a little bit more support or facilitate the access to the healthcare system. It's the case of the HIV community. Other STIs are also connected, like hepatitis and other infections, but also we work with the LGBTIQ community in general, with youth, with women, and with migrants, because we also connect different diversities that are intersectional with the HIV and sexual health topic. We run several checkpoints in our country in different big cities like Madrid or Malaga. And in these checkpoints, we diagnose HIV infections, but also other STIs like hepatitis, syphilis, gonorrhea, and chlamydia, trying to offer a specialized services of sexual health that the healthcare system cannot offer in the same way with this community approach, and with different facilities and mediators and educators that are connected with their own communities. We also perform other programs related with sexual health, like the Ken6 program, peer support, also psychological support, and different projects and activities that are more focused on the quality of life of living people, or people living with HIV, or also people of those communities that we target. And we also have a strong educational program that goes around schools and universities and other spaces, and also train healthcare professionals about our communities and about their realities and how they live their lives, their sexuality, and their rights that normally are more vulnerable and more attacked because of discrimination and stigma. In our services of sexual health, in our checkpoints, we try to improve what the healthcare system is doing related to HIV and other infections. That's why we have this checkpoint, these places in where you can come and test your sexual health quickly in a safe space and with people that is connected with your own realities, because we belong to the different communities that we work with. We are also people living with HIV, LGBTIQ people. Some of our mates are young people, women, or migrants, and that's one of the first steps to connect with these populations that have more problems to get access to the healthcare system right after a diagnosis, for example, of HIV. But as I was saying before, our country has a high number of migrants that are involved in the new HIV infections. And that's also another point that we were taking in consideration to offer more specialized services and other activities around the test to engage these communities, and with a main goal that is to facilitate the health access and the access to treatment right after the diagnosis. In this line of guaranteeing that the person can have access to the treatment after being diagnosed of HIV, we cooperate with the public hospitals and the healthcare system, connecting with the key agents in each hospital to deliver this person right after our diagnosis, almost straight to the hospital, and getting the medication, if it's possible, in less than 1 week, or even in 72 hours, depending on the city or the region or the hospital. But also we have, as I said before, different programs or activities around, not only for offering this test, but also to solve or manage the different needs that these populations have in their daily life in our country. It could be problems in the access to food, to a place to live, or many other issues that are more related with the administrative barriers that we find out in this process. Because one of the main problems that we have managing migrants or refugees that come to our country and are detected with an HIV infection is the own legal framework and the administrative barriers that our system is still keeping in those official or public places. In Spain, concretely, in some of the regions are still running some laws and even are like being more tight, not facilitating the access to the healthcare system and to the HIV treatment for people that was detected here, but they didn't do in Spain. So the idea is to jump over these legal and administrative barriers and get the medication for these people, and also to guarantee that they are going to have a following up process with our specialists in the system. It's ironic that the system places these barriers for getting something that should be universal, like the HIV treatment, but at the same time, they know that we look for the roots around their own norms and protocols to get the medication to these people. And also we work advocating for getting out those barriers to solve all the problems that they have administratively, and get the medication and the healthcare for any person that lives in the country. Doesn't matter from the person is coming from. In a way, our checkpoints are like an open door for these people to find a safe place to solve their needs on HIV or any other issue regarding sexual health, but also are an opportunity to engage with them and solve many other the social realities and needs that they have when they come as migrants and refugees to a new country. Other barriers that we also find in this process of work with migrants and refugees are, of course, the language barrier. In so many cases, it's people that doesn't come with the Spanish as the first language. So we used to have at least one person in each moment in our organization and community centers that speak another foreign language, normally a common one like English, but also another languages that facilitates that these people can have this safe space to talk about their realities and their HIV. Also, we need to manage with different cultural barriers that affect, for instance, the information that they have about sexual health for HIV, or the prejudice that even sometimes they come in their minds about the infection and the communities related with it, and even the future of the HIV infection that they have in mind. Many people still come with the idea the HIV is connected with death and with many problems, and there is a future in the infection, and they can find in these spaces, when we are aware of their cultural backgrounds, a new way of thinking and a way of sort of integrating in a new society, not only in a healthcare system. Also, as I was mentioning before, all these legal barriers and administrative ones are the first one that we have to jump to get this treatment. But also we work hardly in different social programs inside the organization to establish their situation and their legal status in the country as soon as possible, apart of the access to the healthcare system, because they are probably in our country for more time than just when they come for a testing, and they are looking for a legal situation in general in their lives to have an opportunity in our country, especially when they come as refugees, because sometimes they don't have another place or country to come back, or in the case that they come as migrants because of the situation that they have with their communities in their own countries. It's the case of the LGBTI community, or the access to treatment that they have in their countries. That is something that happens with the HIV treatment in many countries like Venezuela or many other countries of South America. So if we help them not only to have the healthcare treatment and access, but also a better life with a legal status, it's like a 360 intervention for us. And of course, we also work with our legal team in some cases that they can have any other barrier, and if they need a legal support, because sometimes also HIV is a new discrimination that comes to their lives apart of being migrant or refugees, and they can suffer any kind of hate action or legal situation that we also help them to manage. And if we talk about solutions, or how we deal with it, or how we solve these daily tasks or needs with the migrants and refugee population, we have different approaches that we've been trying in these years. But the first of all is try to understand this person and bring this bubble of safety in the places where we work. It could be with, as I said before, using another language, or at least be open to have empathy with these people, get someone that can help us in the understanding and the process of communication. And from that, make sure that they have the right information about the HIV, and of course, this access to the healthcare system that I've been saying before. Also, we do a lot of outreach activities. We think that we need to move our setting out of our community centers, and sometimes we deliver testing in other organizations that are connected with those migrants and refugees resources, or we perform activities or workshops about sexual health and HIV in these spaces, even in pubs or locals of the target communities. That doesn't to be, they don't have to be like a proper organization. We move out from our community centers with the idea to engage and involve the people in the places where they are. And this work is pretty successful because afterwards they come to our places when they see that it's a safe space, and they have a professional team that is going to help them instead of putting or setting more barriers. That is the experience that they used to have in the public system. Also, we encourage them to participate in our own activities as mediators or educators in some of the cases, and even participating in our campaigns as a face to engage and to give a reference for all those communities, all those people from those communities that are outside. And another successful activity that we see that helps to connect with the sexual health, with the testing and all the healthcare care that we need to offer around sexual health is these projects and activities that are more connected with those needs, social needs that we were mentioning before. Many of these people doesn't have like a place to be and to live. They don't have enough resources for food. So we are also managing programs for basics in the daily life, for legal services, or even labor programs to train themselves on how to connect with their professional work. And it's another way to engage them with the sexual health services that sometimes they don't think about it. They think about how more about how to survive in the following months. And it's a way to connect both things and getting a success.